PhD from Faculty of Pharmaceutical Sciences, GJU Hisar, where he joined as an assistant professor in 2005. And in 2008, he joined the Faculty of Pharmaceutical Sciences, MD University, Rohtak, as a reader and later promoted to professor in 2014. He served as a head and dean of Faculty of Pharmaceutical Sciences, MD University, Rohtak. Presently, he is serving as a director IQAC at MDU Rohtak. And his key research areas include synthesis, QSR, anti-cancer, and antimicrobial screening of medicinal compounds. Till now, Professor Narasimhan has published around 170 articles in SCI index journals with around 3,492 citations. He has an H index of 31, it is Scopus, and I-10 index of 104, Google Scholar to his credit. He has also published 4 books and 3 edited book chapters from international publishers. Research ability of Professor Narasimhan is recognized internationally and resulted in active collaboration with international scientists from University Institute of Technology, Mara, Kuala Lumpur, Malaysia, in the field of anti-cancer research. He served as an editorial board member and reviewer in the number of national and international journals of repute. He has more than 15 years of teaching experience and has guided 74 postgraduate students and 12 doctoral students, and presently guiding a number of students for their PG and PhD degree. Professor Narasimhan is also a recipient of APTI Best Pharmaceutical Scientist Award 2015 and APB Young Pharmaceutical Scientist Award 2015. So thanks a lot. Welcome again, Professor Narasimhan, sir. Now it's over to you, sir.
Thank you, sir. Anandji. Thank you for the introduction. Very good morning to everyone. I think so. I am audible, sir.
Yes, sir. Audible, sir. Audible.
Can we start the presentation, sir? I think so. Now it is.
Yes. Sure, sir. Sure. Some participants are physically present in our lab, so nothing to worry, sir.
सर मेरे को डिसेबल्ड आया हुआ है स्क्रीन शेयरिंग का.
यस सर.
मेरे को स्क्रीन शेयरिंग है ना, डिसेबल किया हुआ है.
स्क्रीन शेयरिंग सर.
हाँ.
ओके. जस्ट
कर दीजिए मेरे को.
श्योर.
Screen visible है sir?
Yes sir. It's visible.
Very good afternoon to all of you, and thank you Anandji for providing me an opportunity to interact with your faculty colleagues and research scholars. And I am talking on the computer-aided drug design, a tool which is used for what you can say, that is to what you can say for estimation of what is biological or prediction of your biological activity, right? So when you are seeing what is the objective of the computer drug design, so basically when you are seeing that is suppose when you are seeing our traditional drug design techniques, generally we used to say that is in the drug discovery part, we used to say that is where we used to take the number of compounds, what you can say, all your drugs, you might be seeing there is mostly all your drugs, basically they are the, what you can say, mostly all your drugs, they are the chemicals, right? So when you want to develop the new drugs, what we will do, we will take the existing molecule or we will take some chemical molecule and we will make the modification, right? Then we will test it in the animals, and if it is become successful in the animal model, it is successful candidate in the animal model, then we will go for biological activity testing in the human, then we are releasing the drug into market. And when you are seeing this phase, right, so mostly you can say that is your more than lack of compounds we used to synthesize, and among the lack of compounds only very few compounds, right, one or two compounds they are coming to the market, right? So this process, it will take, that is the very time consuming, and also it is money involved. So they have developed this technique, that is computer aided drug design technique, which you can say that is your reduce the time required for discovery of the drug. That is what the based on your computer drug design technique. We will take the molecule, right? What are the molecule we plan to synthesize, right? So don't synthesize, just you can draw it in the draw a structure on a computer screen, and you in the computer screen itself you study its interaction with the receptor. Whenever we are saying that is a you can say that if you are having a fever, we used to take paracetamol, right? Or if you are having the pain, we used to take aspirin, right? So what it will do, that is your paracetamol, we are taking the drugs, all the drugs we are taking to the oral route, but it is showing the different activities. You have some joint pain, you are taking some medicine, or if you are fever, you are taking some medicine. If you are having infection, you are having some medicine. So what means you are all the drugs you are taking to the oral route, but they are curing you from the particular disorder. That is through by they are interacting with the receptor, right? In your body, you are having a different receptor. So in the receptor, they will interact and they will, what you can say that is, they will produce the activity. So this computer screen, right? So what we'll do, we will take the receptor and we'll take the molecule which you plan to synthesize and try to study their interaction. The molecule which is having the very good interaction on a computer screen, it is believed to be what you can to be more active in the reality also. So by that way, you can reduce the time required for your identification of the new molecule. Okay, so this is the objective of the computer drug design. One is the lead identification, lead optimization. You will find out how to, if it is binding, so what are the other groups you can add to improve the binding that you can do. Then candidate evaluation, you will identify the winning molecule, right? So this is the what I told you, the traditional drug design. Sir, am I audible? कोई दिक्कत तो नहीं आ रहा है? Hello.
No, sir, no problem, sir. It's okay.
Okay. Audible ना? ठीक है.
Sir, audible.
It's for what we learned.
So when you are going this traditional drug design technique, in the traditional drug design,
You're not properly
Hello?
audible. Yeah, you're not properly audible. And there is a problem with audio. I mean, I don't know.
Achha. Now is it? Am I audible, sir? Now?
I'm getting your voice, but it's not not perfect. Like.
Achha. Abhi sir, voice आ रहा है sir अभी?
Yes, yes.
Better.
Better?
But just can you just speak a little bit more?
हाँ जी.
Can you speak so that we can test your we are getting your voice or not?
Hello. Hello.
Just
हाँ जी sir. Audible?
yes, sir. Yes, just increase your volume, sir. That's it.
Just a minute sir. Now you are getting sir clear? Hello.
Yes, sir. Yes, sir.
Are you getting it clear sir now?
Yes, sir.
Can I continue?
Sir, Anand sir, actually your voice is clear in the lab, but the only problem is sir's voice is not very clear.
मतलब? Like, I'm not getting. My voice is not getting clear.
Yes, your voice is not very clear. Actually, we had a temporary arrangement in the lab. We installed a speaker. I don't know. Anand sir's
Okay.
voice is pretty clear, but yours is not that clear.
Okay.
Can you just wait for a minute? We are trying to make people use the headphone.
Okay sir. Okay. Is it okay now, sir?
Please share your screen, sir.
Yes.
Right, sir.
Am I audible now?
Yes, sir. Yes. Yes, sir.
If there is any problem breaking your voice and other things?
No, not at all, sir.
Not at all. If there is any problem, then you can say I can then join. I will join from through mobile.
Okay.
Then if you are having any problem, can you inform me? Okay. So can I continue, sir? I think so.
Yes, sir. Yes.
No. If the voice is breaking, just you can inform me.
Sure, sir, sure.
So when I told you that is the when you are seeing the drug discovery process, there is a traditional drug discovery process. In the traditional drug discovery process, basically what you can say that is we used to do in the traditional drug discovery process, we used to synthesize, that is your olden times, we used to synthesize number of compounds and we used to test it for a particular biological activity. First we will test it in the in vitro model, then we will give to animals, then if the molecule is successful, then we are testing in the human being, then that is clinical trials, then we are marketing the drug. So it will take, that is the what you can say, number of time, that is the time is also required is more, and also you have to invest lot of amount on the synthesis of your different molecules. Whereas this is the traditional drug design technique, that you can generate the lead, then test it for biological activity. If it is promising, then you can go for clinical studies. If it is not promising, again you can synthesize the new molecule. So this process you will repeat it continuously, right? So when you are going for, this is the traditional drug discovery process. When you are going for modern drug discovery process, just we can say that is your, you can say this is the average period required for your discovery of the drug. You will modern drug discovery, that is based on the target base. Previously, that is your drugs, they are discovered without the target. They will say that is they will synthesize the compound, that is called as your phenotypic screening. You can identify the molecule and you can test it for biological activity. And if it is promising, then you are marketing it without knowing its target. But modern drug discovery process is a target based, that is the receptor based. You will identify the target, then validate the target, then identify the basic molecule that is fit into the target, then you can go for optimization of the molecule, then you can go for your clinical and drug discovery. So this is around 10 years, that is the average life period, right? So your modern drug discovery process, that is the this lead identification, lead optimization, everything that can be done by means of your computer-aided drug discovery process. Only thing, you have to know the target, and once you know the target, you study the target site, and you can find out the active site of the target, that is the molecule where it will interact, that is the binding site of your drug molecule. Accordingly, you can place a suitable group on a chemical molecule and you can try to study the interaction. So that will be, you can say that is the beneficial, right? For a simple example, I can say that is why you are, there are basically two techniques which I want to discuss with you today, that is generally followed in your bioinformatics of the drug discovery process. One is the 2D QSIR and another one is the 3D QSIR study. Yes. Is any problem, sir? No.
No, sir.
Okay. So when we are going for this particular method, that is our 3D QSIR methods, why we are going for the QSIR studies? For example, you can see this is the indole derivative that has been synthesized, right? So that is 19 compounds that has been synthesized. For the 19 compound, we have developed the QSIR model. What is the advantage of this model? Suppose if you want to synthesize the compound number 20, no need to go for the synthesis, right? When you are saying for drug discovery process, you have to synthesize lack of molecules before discovering one drug. So this is the, if you are going for this 19 compound, we have the equation for so for the compound number 20, you can find out if this equation indicates the biological activity. It depends on the lipophilic parameter log P. For the 20th compound, you find out the log P value, right? And substitute it, and you can see what is the biological activity of the new compound. The new compound is having a better activity than the existing compound, then you can go for the synthesis or you can reject it. This is the advantage of your computer-aided drug design, whether it is a 2D QSA or 3D QSA. The advantage of your this machine learning technique or your computer-aided drug design, the technique, that is you will able to what you can say, that is the identify the biological activity or identify the particular property without much experimentation, right? You can predict the what may be the property of the molecule, right? So if we are able to predict the property of the molecule without need to synthesize them, then you will say there is no better technique other than this. You can reduce the number of अनंत सर, आप अपने लेवल में म्यूट कर दीजिए ना, जो कोई अनम्यूट हो रहे, right? So without a need to synthesize them, you can identify the what you can say, that is of the nature of the molecule. So when you are saying the 60 to 70, you can see, you may ask, that is where we are saying that is the computer drug design is one of the technique which will what you can give you the active molecule, whether it is really successful in the reality. Yes, it is successful, right? When you are seeing the 60 to 70, the QSAR, it is focused on the lead optimization. They have taken the, you know, the basic compound, lead compound, means compound which is having a minimum required biological property, and it may have some toxicity or unwanted effects or some pharmacokinetic problem. So you have to optimize it to get a better molecule. 60 to 70, the QSR is focused on the lead optimization. So during the period, that is the narfloxacin, that is the drug that has been marketed. It is a fluoroquinolone antibiotic, right? Now we are having the ciprofloxacin. The first compound is the narfloxacin that has been determined, discovered by means of your QSAR technique, right? Then there is another compound, that is the losartan. It is an antihypertensive that also developed. And 78 is, that is the molecular modeling, that is the shifting from lead optimization to your lead identification, how the molecules they are interacting with the receptor. This is the ribbon shaped ones, they are the receptors, and this is the molecule, what you can say, that is the, you can say this is the during this period, you can say that is your eposartan, that is the molecule that has been discovered. And next one, 90s, it has been in 2000, it has shifted from your 3D QSAR and docking studies, right? So this is the better methods, you can say, that is your used. Let us see, that is your what is the difference between SAR and QSAR. SAR, that is structure activity relationship. It says that is the how the structure activity relationship, how the biological activity changes when you are making a small change in the structure. Suppose if we are having the salicylic acid, that is a simple molecule, right? Salicylic acid is a molecule. It is used as an, what you can say, that is an antibacterial, right? Or you can say that is when you are putting the group of salicylic acid, right? So this is the molecule salicylic acid. If you are putting the salicylic in the salicylic acid, right? For example, this is your salicylic acid, right? This is the molecule salicylic acid. This molecule is an antibacterial. If we are replacing this hydrogen group with the acetyl group, then it is known as the acetyl salicylic acid, or you can say it is called as your aspirin, right? It is a very good analgesic molecule, right? So you can say that is what I want to need to say to you, that is the structure activity relationship, how the biological activity changes when a small modification to the structure of the drug has been made. That is what is called as your structure activity relationship. Instead of how, if we are putting the term how much, मतलब कितना change हो गया, then you can say it is a quantitative structure activity relationship, right? So this is the flow chart of your QSAR model. That is your when you are going for your QSAR technique, we will take the input molecules, right? You can draw the structure. After structure, you can go for optimize the energy of the molecule, because you have to minimize the energy of the molecule in the when you are going for QSAR studies, because minimum energy conformation is the most stable conformation. After that, you can calculate the descriptors, molecular descriptors to the structure. Then you can go for the statistical analysis. You can go for the regression analysis, linear regression, multiple linear regression, partial least square, depending on the tool you have used. That is depending on the technique you have selected for analysis. Then you can build the QSAR model and you can validate the QSAR model, right? So when you are seeing the first thing which comes in this drug discovery techniques, that is you have to go for the molecular descriptors. Molecular descriptors is nothing but, suppose we are saying that is, for example, I am taking the molecule of your aspirin, right? Or you can say that is your salicylic acid, right? In the salicylic acid, I want to make different derivatives, right? I may have different substitutions, right? So if I'm making different substitution, I will get the different derivatives. So I want to say what is the purpose of my study is I want to develop the drug better than your aspirin, right? So I have to make the derivatives of aspirin and I have to test it for their biological activity. And if they are promising one, then I will go for clinical studies and I will market it. But again, the modification, how many modification I can make in the aspirin, means that is n number of modification I can make. So you are having the different positions. You can see this R1, this is R2, this also, here also you can make different substitution. Here also you can make different substitution. Here also you can make different substitution, right? You can see this position also you can make substitution. This position also you can make substitution. Around 6 positions, mean you can see at one position you are making 1000 substitutions, means 6 positions, you can make 6000 molecules, right? Or by combination, you can synthesize the lack of molecules. But whether all the lack of molecules are they are useful, mean no. Out of lack of molecule, you may get 1 or 2 molecule as the active molecule. So if you assume that if you are synthesizing lack of molecule, how much time you require, then how much chemicals you have to purchase, then how much manpower you have to implement, then how much animals you have to test it. To avoid this, what you can see this QSAT, what will say, you can take some synthesize some 30 to 40 or 50 aspirin derivatives, and you can develop the QSAR equation, right? And use this equation to predict the activity of another lack of compound, right? Without a need to synthesize them. To how you can develop the QSAR equation, mean you have to take the, suppose you have synthesized 50 compounds. For all the 50 compounds, okay, or all the 50 aspirin derivatives, you can calculate the molecular descriptor. Mean you can calculate the property of the different property of the molecule. That is the lipophilic parameter, electronic parameter, steric parameter. Okay, now you are having number of software tools they are available, right? So you can usually calculate them. Either you can use even the ChemDraw software also, that is used for drawing the chemical structure. The tool also able to, you can determine number of molecular descriptors. To calculate the molecular descriptors and try to correlate with the biological activity. So here basically we are having the two variables. One is the independent variable, then another one is the dependent variable. Dependent variable is the which property you want to calculate. That is the biological activity, the dependent, because it will depend on the structure, and the different parameter which are arising out of this structure, they are called as independent variable, because the structure is biological activity will depend on the structure, not the structure will depend on the biological. Right. So when you are seeing the what you can see, that is of your When you are going for, that is again when you are going for your calculation of your molecular descriptor, there are so many molecular descriptors, more than 1,000 molecular descriptors you can calculate. So how you can identify the most active, developing the QSA recognition also, you have to see that is which molecular descriptor is important for biological activity. So for that, first you can construct the correlation matrix, right? So this is the correlation matrix, what you can say. You can say this is developed for your log of antifungal activity, one biological activity, and this is your different molecular descriptor that has been calculated. You can see that is which molecular descriptor is showing the maximum correlation with biological activity. This is the molecular mass, right? 0.792, right? So with the molecular mass, you have to develop the equation. Again, this correlation, yes, again this correlation matrix, it will help you to what you can say that is the, again when you are doing the QSR study.
Sorry to interrupt you, sir.
Yes, 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 बताइए. Hello.
No, sir, you can continue. I think there was some disturbance.
Okay, okay. Just a minute. When I'm saying that this particular method, that is the this correlation matrix, mean I told you that is where when you want to go for your construction of QSAR equation, you have to see that is your basically that is how the structure is correlating with the biological activity. When you are developing the number of parameters, I told you that is like your each molecule, you can say that is you are having the open access software that is called as your Dragon, that is available. So if you are putting the structure, inputting the structure on the Dragon software, it will able to calculate you can say that is your thousands of properties, but not all the thousands of properties, they are important for biological activity. Minimum one or two properties, they are maybe one property or combination of 3-4 properties, they are important for biological activity. So how to identify which parameter is important for activity? Suppose you are calculating 1,000 parameters and developing the 1,000 with each parameter. If you are developing the equation, means that is 1,000 equation you have to develop. After 1,000 equation, then you will see which parameter is having a very good correlation. Mean correlation means that you have to see along with which parameter you are getting the R value closer to 1. That is, you can see in statistical, you might have studied the correlation, that is the R value equal to closer to what? 0.99, right? Above 0.9 or above 0.8, you can say that is a very good correlation. You can say it should be closer to 1. So this correlation to closer to 1, it may be obtained with a single parameter, or it may by your more than one parameter. Mean if you are getting a correlation of close to 1 with a single parameter, it indicates the biological activity is what you can say that depends on a single molecular descriptor. Or if it is depends on, if you are not getting R value close to 1 with single parameter, then you have to say that you have to select more than one parameter. You have to add the second parameter, you have to add to the first parameter, then you may get a R value closer to 1. For this example, this case, you can see to identify which parameter is the important, you construct the correlation matrix. When you are constructing the correlation matrix, you can see this correlation matrix, you can see there is the, you can see number of parameters. It may be 1,000 mean you will get, it will continue, the 1,000 parameters you will get it. You have to identify which parameter, the yellow one, and red ones it is highly correlated, and yellow ones is also that is appreciable correlation. So here molecular mass it is 0.79. So molecular mass is not closer to 1. So you have to closer to 1 mean you should get above 0.9. So you have to add the other parameters. When you want to go for other parameters, that will also decided based on this correlation matrix. So here you have to see that is your with the correlation matrix and the this direction you have to go, that is your on which what you can say that is of your, for example, when you are going on this direction with the molecular mass, we have to see that is which parameter is having a low correlation with the molecular mass, right? You can see that is of your 393, 293, right? So this 344, that is a kappa index 2, that is having a low correlation. So when you want to go for this two parametric model, you have to combine the molecular mass, right? Molecular mass that you have to combine with your this kappa index, then you will get a better R value. You cannot combine the two parameters which are highly correlated with each other. You cannot combine the molecular mass with the molecular refractivity, right? Or you cannot combine it with your chi V0. You cannot combine it with your chi V1 because they are highly correlated. So you cannot combine them in the multiple linear regression, right? Regression, you can see there is linear regression, multiple linear regression. Linear regression, you know that is the straight line equation, y equal to ms plus c. When you are doing the multiple linear regression, you will add the more than one parameter. So that for the identification, there should not be no correlation between them. This is called as the autocorrelation. Highly correlated, they are called as autocorrelation. So what you can see, first you can construct the correlation matrix, then identify the highly correlated, what you can say that is your parameter, right? Then construct the model with the parameter. If the R value is not near to 1, then you can add the second parameter based on the collinearity principle. Collinearity principle means there should not be any high interrelationship between the parameters. Okay, so that is known as your collinearity, right? So this all your different QSAR methods, that is Hans analysis, free Wilson analysis, 2D QSAR, and 3D QSAR. We will see some light. I will throw you some light on your Hans analysis, some on your comparative molecular profiling and docking. Okay, so these are all the widely used techniques even nowadays also in the drug discovery method. Okay, so when you are seeing the Hans analysis, that is in the Hans, he has correlated the biological activity with the lipophilic parameter log P, right? And he gave this particular equation, that is the nonlinear equation, that is the log P, A log P minus B log P square plus C. These are all the regression coefficient ABC, right? Then this is the equation. Then they have initially, when they are developed answers identified only the lipophilic parameter, right? When you want to say what you mean by lipophilic parameter, suppose when you are taking the drug molecule, right? So it has, the drug has to reach the target site. I told you that is when you are taking the drug molecule, right? It will reach the target site. It will reach the your receptor through the, what you can say, through the blood circulation, right? So suppose we are having a receptor at the, what you can say, at your leg and one receptor at your stomach, right? Or you can see that is the drug action is at the different receptor, right? So when it want to, first thing that you are taking the medicine through a oral route, it has to enter into your systemic circulation. That is, it has to enter into your blood circulation. After entering into the blood circulation, it will go to a particular receptor or target, right? So this transport across the biological membranes, right? So that is a very important one. It depends on the lipophilicity, mean that is your lipid nature and watery nature of your different biological membranes. Some of the membranes are highly lipophilic, some are your highly, what you can say, that is the, basically you can say highly hydrophilic. So your drug have the proper balance between lipophilic and hydrophilic, then only it will reach the particular target site. So this, so based on that, that is initially Hans has thought only this transport of drug is very important parameter. So they have developed the, correlate the biological activity with your, what you can say, that is of your lipophilic parameter. And later on he has identified, he added the parameters other than your what you can say, that is your lipophilic parameter also important for biological activity. So they have given the combined equation. And when you are seeing the minimum requirement for your QSR study, number of compounds should be several times than the parameter used. Suppose you can say that is your maximum number of compounds, that is where basically this QSAR technique, it is a statistical technique. That 2D QSAR, hands-on statistical technique. So if you are having the maximum number of samples, means reliability will be more, and minimum of 25 to 30 compounds to avoid the what you can chance correlation, and R should be around 0.9 for in vitro study. The correlation should be around 0.9 in vitro study, and minimum standard deviation, standard error, and F calculator should be more than F table value, and I Q squared value. I show you that is obtained by the leave on out method. Okay, so let us see the equation, then you can understand better, right? You can see this is the different parameters. This is the standard error, should be a minimum, and standard deviation, it should be minimum. R value should be closer to 1, and Q squared value, that is the, it should be closer than more than 0.5. Okay, basically for qualifying the QSAR model as a better molecule, the Q squared value should be more than 0.5, then you can say the model is the valid, right? Valid model should be more than 0.5, right? And F value, that is the Fisher value, right? It will allow generated automatically. Basically, that is based on when you are seeing the biological statistics, you might have seen the Fisher table. In the Fisher table, this, well, what is the table value what you have given, that is the value what you have generated when you are calculating the equation by using the SPSS or any other software. This table value should be more than the calculated value should be more than the table value, then you can say it is significant. This is the number of compounds, it should be a maximum one, right? So what are the different steps involved in your hands analysis? You can see first you have to sketch and energy minimize the molecule. You draw the structure of the molecule and minimize the energy of the molecule. Then you can calculate the various molecular descriptors. Then you can convert the biological units into logarithmic units. This is another one. You can see what is the relationship between the biological activity and the, what you can say, that is of your parameters, that according to, suppose if we are taking the antimicrobial activity, we are determining the minimum inhibitory concentration. When we are seeing the minimum inhibitory concentration, one compound, that you are having to compare the two different antibiotics. One antibiotic having the minimum inhibitory concentration of 0.2 microgram, and another antibiotic, it is having the minimum inhibitory of 0.5 microgram. Then the most active one is the which is having the 0.2 microgram. Here you can see the concentration is low, then you can say biological activity is more. So the inverse relationship, so you have to take the inverse log when you are converting the biological units, or you can say there is any property in that particular category, you have to take the inverse log. If it is the direct relationship, then you can take the direct log, right? Then you can develop the QSAR equation by linear or multiple linear regression. Then you can cross-validate the model by your calculation of Q squared, comparison of observed predicted activity, and checking for the presence of systemic error. You will see what is the different this parameter, right? So when you are seeing the hands analysis parameter, you have to consider, that is the rule of thumb. Rule of thumb means that if you are having a 5 fingers, right, you are having a one thumb finger. So similarly, if you are having a data set of 5 compounds, you can select one parameter for development of QSAR model. So that is the rule of thumb. Then you have to go for the selection of training and test set. I mean, training set is the set which has been used for development of your QSAR model, and test set is the new compound, set of new compounds for which you can predict the activity, or you can verify the validity of your QSAR model developed. Then another one, cross-validated R squared or Q squared, that is generally obtained by leave on out method. Suppose you are having a developing equation by means of your 30 compounds, assume that. So in the leave on method, what it will do, it is an internal validation process that is all inbuilt in your different statistical software. In the leave one out method, so they will say that in the first set, in the first cycle, it will leave compound number 1 and take the remaining 29 compounds and it will develop the equation, right? And the second cycle, automatically it will do include compound number 1, it will remove compound number 2. So like that, each compound will be removed once. So then you will get the R squared value for 30 equations. That average R squared value is the Q squared value. It should be more than 0.5 to qualify the model to be a valid one. Then another one, multicollinearity, that I told you, that is multicollinearity, autocollinearity, that is if you are not getting the R value closer to 1 with a single parameter, you can combine it with the you can combine the two different parameters. The interrelationship, the correlation between the two parameters should be very less. If they are very high correlation, then it is called as multicollinearity. So that you have to see when you are combining the two different parameters, there should not be any interrelationship between them. Then another one is outlier detection and its removal. Sometimes when you are going for QSAR studies, you may find the outliers. Outliers mean their presence will affect the overall regressions. If you identify them and remove them, then it will improve. You will get a better QSAR model. For example, you can see this is one example I can show you. Right, so this is the model. You can see that is the we have developed the QSAR equation with the 17 compounds. With 17 compounds, it is R value is 0. So we have removed 3 compounds, then it will become the R value closer to 1. I mean, this type of compound they are called as the outliers. So this we have to, what you can say, you have to remove it, right? So this is the another thing that you have to see in here. Then another one, systemic error. Systemic error means that is where you have to identify the when you are going for final validation, you will identify that is the, what is the observed activity that you have observed experimentally, then what you have predicted by means of QSAR equation. If the model is valid one, there should not be any difference between observed and predicted, but still you won't get the R value as 1. You will get 0.9, 0.8, 0.7 like that you will get. So you will, there is a difference in your observed and predicted activity, that is called as your residual activity. So this residual activity, suppose we are having the 30 compound, you should get the residuals on both the sides of the 0. You should get it on both positive side and negative side. That is called as your, if you are getting residuals on both the sides of 0, then you can say there is no systemic error exists, right? So this is one example. You can see this is the compounds that what we have synthesized, simple amylides, that is benzylidine, hydrogen derivatives, right? So this we have two schemes we have used for synthesis. Then these are all their properties what I have determined. So, and this is their and microbial activity against the different microorganisms. You can see that it is Staph aureus, Bacillus subtilis, E. coli, Candida albicans, and Aspergillus niger, right? So these are all the different 20 structures we have drawn, and we have identified their molecular descriptor values, right? And to identify which parameter is important, we have considered correlation matrix, and you can see with the maximum R value, you can see it is identified with your total energy. So we have developed the equation for Staphylococcus aureus with the total energy, right? So this is the what you can say the total energy of the we have developed. You can see this is the model that has been developed for the total energy. Okay, so this equation, right, it will give you the idea about how to what is the importance of this equation or how it is useful in the drug designing. You can see there is the 20 compound that is synthesized benzylidine hydroxide. Their antimicrobial activity against the Staphylococcus aureus, it depends on the total energy of the molecule, right? How it is depends, you can see it is the value minus 0.00017. It indicates if the total energy is the biological activity is negatively correlated or inversely correlated with your biological activity. Total energy is inversely correlated because the sign is negative. So it indicates the total energy of the system is less than biological activity will be more. You can see this is the, you can see the values. You can see the compounds, compound number 15, it is the having a very high total energy, right? Compound 3 and 4, it is having a very low total energy because it is in the negative side. Minus 3 is higher value than your minus 5, right? So this is the, you can see according to the statement, total energy is less mean biological activity should be more. Now you can see the biological activity of 3, 4 and 15 against the step RS, right? And 3 and 4, you can see it is biological activity is high and 15 it is biological activity low, right? So what it indicates, this particular equation, say that is the QSR equation, it gives you what is the importance of your QSR equation. It will show what is the relationship between the molecular descriptors and biological activity. And another one, it says that is the, suppose it is showing it is, if you are decreasing the total energy of the system, biological activity will be more. So another 100 compounds or lakh of compounds you want to synthesize, you want to make. So you can add a suitable substituents in such a way that which will decrease the total energy of the system. Then definitely you will get a better molecule active against the Staphylococcus aureus. With this the equation for Staphylococcus aureus, it shows the equation that is the biological activity is negatively correlated with the total energy. It means if we are decreasing the total energy, biological activity will increase. So in future compounds, what you plan to design to synthesize, what you can do, you can decrease the total energy so that you can get a better compound. Okay, so this is the model developed for the other organisms in a similar way based on their correlation. And this is, you can see observed value and predicted value and residual value. Right? I told you, you can see this residual value on the both the sides of zero. You have some positive residuals also and you are having some negative residuals also. So then you can say the difference between observed and predicted is the residual value. So if you are getting both the residual, positive and negative residual, then there is no systemic error in your model development. You can see this figure shows there is no systemic error in the model development because residuals are both sides are zero, and this is the regression line. Closer to regression line, the points are there, then you can see the better model, right? So this is the different scopes and limitations of your ANS analysis because it will advantage, it will correlate the structure with biological activity. You can predict the activity of the new compounds, and there are a number of delimitations. You should have the parameter value for each compound because you cannot solve the parameter value for your salts, or you can say that is your complexes. And being a statistical technique, you require more number of compounds. It depends on the biological results. If the biological activity determination is wrong, then the predictions also will go wrong. Right? Interrelation, there is autocorrelation among the parameters, and you should select the proper training and test set. And it is a lead optimization technique, not a lead discovery technique. It considers only 2D structure, and it is the sometimes the predictions which we are making out of the answer list, it may become failure. That is, you are rejecting some compounds based on the answer list, they are not active, but really they may be active. But this is the possibility with any theoretical technique, but still this method is the widely used method. Then another one, when you are going for the 3D QSAR studies, so that is the, we can see that is the pharmacophore. Pharmacophore means the compounds, or you can say that is the pharmacophore. See, this is the receptor site, right? This is the binding site of your receptor, right? When you are seeing the binding site of the receptor, you can see this is the receptor site, right? So generally, your receptors, they are made up of your proteins, right? When you are the receptors are made up of your proteins, mean they are made up of your amino acids. When they are saying they are made up of your amino acids, mean you have the amino group and carboxylic acid group. So the interaction of your drug molecule with the receptor, it will be either with the hydrogen of the amino group or carbonyl group of your carboxylic group or OH group of your carboxylic acid group. So that's why mostly your binding of your drug with the receptor, that is by means of your hydrogen bonding. You know, hydrogen bonding, that is due to your between the electropositive hydrogen and electronegative oxygen. Right? You can see this is the binding site. So this is the receptor site. This is the molecules you are. These are all the groups that are binding in the receptor site. Mean what is the possible binding mean you to for bind with this particular receptor, you require the oxygen group so that you can get the hydrogen bonding. Here it is oxygen, so in the drug molecule require the OH group. Here it is the hydrogens in the drug molecule, you can get the carbonyl group. So this is the requirement of your drug molecule to bind with the receptor, right? So these groups are known as the pharmacophore. And you can see we are keeping the pharmacophore. Here you can see there is the open chain structure and this is the closed chain structure. Both the drugs, they will bind with the same receptor because they are having the same pharmacophoric group, which are required for binding with the receptor, right? So when you are seeing this docking studies, it is the widely used technique nowadays to discover the drug. It will help you to identify it is a structure-based drug design. It will predict the two things, that is the pose of the molecule and the binding affinity of the molecule. That is, it will study on a computer screen how the what you can say that is your drug is binding with a particular receptor. You can see how the molecule is binding with the receptor. This is the drug receptor complex. And what is the importance of pose prediction? Right? This is the molecule, this is the receptor, and the receptor is the molecule is binding. Right? These are all your different amino acids, that is arginine. I told you receptors are proteins. The proteins are made up of your amino acid sequence. Through each different amino acid connected through your peptide bond that will give you the receptor, the protein. So this molecule is binding with your different amino groups. You can see this is the binding. You can see here it is this is the oxygen. This is your oxygen and this is the nitrogen. Blue color is nitrogen and red is the oxygen and gray color that is the carbon, right? You can see here the receptor with the receptor drug molecule is interacting because you can see that is the negatively charged oxygen and this is the positively charged hydrogen, NH group, so it is a binding. But here you can see there is no binding. The reason is that there may be in the here also you may have the oxygen group. So you can see this, since both are having the receptor also having the oxygen group, so there is no interaction. Suppose if you want the interaction, you want to have the either hydrogen over here or hydrogen over here, right? So here you cannot change the hydrogen in the receptor part because it is a natural system. But this is the drug molecule. You can change the substitution. Instead of carbonyl group, you can put an amino group. So you can, that is the this amino group, you can place one amino group over here also, right? So that it will have the interaction with the receptor. So this will, you can say that is the what is the importance of this studying docking studies. We can see which parts are important for binding and we can suggest the changes, that is which are what you can say that is of your which are important for your binding and which changes will improve the affinity and what are the changes that will avoid the clash with the protein, because if this is producing clash with the protein because it is not binding because of the opposite charge. This is the importance of your docking studies. When you are going for docking studies, the different steps, right? You have to select the appropriate ligands and you have to select the appropriate conformation of receptor and appropriate conformation of your ligands, combine the ligand receptor, that is the docking, and evaluate the binding energy between them, and you can select them. So when you are going for your, so basically in your docking studies, you have to select the ligand molecule. Ligand molecule means your drug molecule which you want to screen by means of your docking study. So again in the selecting the molecules also, there is the different criteria. Generally commonly used criteria, that is Lipinski rule of 5. You can say you can select the molecule which is the 5 or few hydrogen bond donors. You should have the molecular weight less than 500, last P less than 5, and compound having the hydrogen bond acceptor 10 or less hydrogen bond acceptor. Okay, so this is required for your, what you can say, that is the selecting the molecule for docking studies. You can select the molecule from your in-house database, or you can select from the literature, right? You want to discover the new drugs, you can select different molecules. In this docking studies, there is no minimum synthesis required. Just you draw the structure of the molecule. On a computer screen, you study the interaction between the drug and receptor. If the binding is good, then you can go for the synthesis. Okay, so that is the basic principle, right? So these are all the different features of the molecule. You have to see. You have to see what are the hydrogen bond donor features, what is the acceptor feature, what are the negative features, positive features. Because I told you the binding of your drug will be receptor, that is through your hydrogen bonding, because only hydrogen bonding is favored because your proteins, receptors are made up of your proteins. Proteins are made up of amino acids. So you have the available groups is the amino group or carboxylic acid group. So you have to see what are the hydrogen bond donor features. That is the OH, NS, and CH. They are the hydrogen donor group. Carboxylic acid is not a donor because in vivo it is converted into carboxylate ion. So you cannot say that it is a hydrogen donor. It is a negative feature, right? Similarly, your dimethyl amino group is a positive feature because it will take the become nitrogen will take the lone pair of electron, and it will take the hydrogen, so it will become the positive feature. So this you have to see. Similarly, hydrogen bond acceptor feature, nitrogen, sulfur, and oxygen with the lone pair of electron, they are called as the hydrogen bond acceptors. And you cannot say the furan ring, the aromatic ring. You are having the furan. The furan, the oxygen atom and the furan is not considered as the hydrogen bond acceptor because it will involve in the aromaticity or delocalization of the ring, right? And positive and negative feature, I told you that is the carboxylic acid is the positive, negative feature, and nitrogen is the negative feature because in vivo it is in the body it is converted into COO minus, and it is take the proton, it becomes positive. And another one, customized feature, means that is specific for a particular receptor. For example, that is carbonic anhydrase inhibition. You can see you should have the sulfonamide group. It is the pharmacophoric group that is required for binding with the carbonic anhydrase enzyme. This is the carbonic anhydrase inhibition that is used in the diuretic property, right? So then you have to, you can say that is the prepare the receptor. You can say that is your receptor can be what you can say, you can get it from your protein data bank. Okay, so this is the open source site where you can download the different proteins, right? Every week or every month, every week they will, every week one they will say that week of the molecule of the week, molecule of the month. They are even the COVID-19, the protein receptor structure is available in the PDB website. And if you want to develop the drug against the COVID-19 virus, you can download the protein structure from the PDB website, and you can say that is, for example, I can show you also the site. You can see there is a PDB website. is available. You can see the number of molecules. You can see this is the PDB website, protein data bank website. You can see the molecules, they are available. You can, it is open source, that is open source, you can freely download. You can see COVID-19 virus also it is available, right? You can download it if you want to develop the drug against the COVID-19. You can download the molecule, right? And download the virus, and you can say that is your, what is the sequence of the coronavirus. You can see what is genome sequencing, and you can see what is the structure of the molecule. That is the fusion. They have given the molecules. You can download the molecule, and you can say that is the PDB molecule, that you can say that is the, they have given the complete details. This is open source. You can download it and you can use the molecule for drug discovery, right? So you can select it from the protein data bank. Then you can say next one, that is you can go for the docking studies. Basically, you can say docking study means that you will study the interaction between the drug and receptor on a computer screen, right? So here in the docking studies, you will find out two things: that how the molecule is, what you will find out the force prediction, and also you can say that you will find out the binding energy. Any molecule which you can say that which requires the among the, if you are studying the interaction of your, for example, 1,000 molecules with the coronavirus, and you have to identify the molecule which is having the very less binding energy, which require very less binding energy to bind with the receptor, then that molecule is having a very good docking score, right? That molecule you can select it, right? Again, in the docking study, you have to see the different consideration. You have to see how the receptor structure you are preparing, and what is the selection of active site molecule. Mean water molecules are present in the body. If they are presenting at the receptor active site, that you have to include in the docking also. Then you will get a better result. And what is the size and flexibility of your drug molecule and receptor molecule. The consensus docking means you will use two or three docking algorithms together, scoring algorithm together, and the consensus score between the docking algorithm will be have a better result compared to single scoring algorithm. And incorporation of your pharmacophoric constraints. You will add the pharmacophoric constraint or requirement to your docking program, so that we will get a better docking result. Okay, so this is, you can see that is one example I told you of the active site water molecule. This is the docking without the water molecule. It is showing the molecule is a very good RMS score. RMS score less than 2, then you can say that it is a very good docking. It is good for the docking study. You can see this is the normal one. This is with the water docking. You can see it is RMS score is 1 point, standard docking, and water docking you can say it is the 0.24. So in the standard docking it is RMS is not good, but when you are going for water docking, it was going a better RMS score. So always you have to see that is the in presence of water molecule, you have to see if that it is present, that you have to see. And you can see docking procedure. Basically there are two procedures, that is the manual docking or automatic docking. That is basically you can say that is the rigid docking or flexible docking. There are the different programs. So what you mean by rigid docking? Mean you can select a particular conformation of receptor and particular configuration of ligand molecule, and you can study their interaction with the on a computer screen, right? So that is the rigid docking. Flexible docking means during the docking studies you can receptor molecules, right? When you are seeing the proteins, they are having carbon-carbon single bond, right? Amino acid. The carbon-carbon single bond rotation will give you the different conformation of the molecules. You can keep the receptor molecule as a flexible, or you can keep the ligand molecule as a flexible, or you can keep both as flexible, but generally they are keeping receptor molecule as a rigid one, because flexibility, if you are allowing the receptor molecule, then it will, you can say that is the, it will have the more, what you can say that is your complicated and it will take more time. So they will generally go for the flexible docking by keeping the molecules as a flexible one, drug molecule as a flexible one, right? So this is what you can say. You can say that is your manual docking procedure. You define the binding site and binding group of the ligand. Then you can start the docking procedure and you study the interaction. And then another automatic, you can say that you can keep the any one flexible, right? Most docking site, what I told you, receptor as a rigid molecule, and they are carrying out the docking studies. And the last technique which I want to show is that is the compared to molecular field analysis. Again, this is the another method that is also used in your computer-aided drug design, right? So in the what you can see that is your in the computer-aided drug design, what you can see first you can construct a grid box, right? So that is the like a receptor structure, and you can place the molecule, right? You can place your molecule. Okay, so this is the pharmacophore. Then after over the pharmacophore, you can place your molecule, right? This is the molecule I am placing it, and you can select one probe atom, right? We have take select probe. It may be a carbon atom or electropositive atom or electronegative atom. In this probe atom, what you can do, you can keep the probe atom on the different points over the molecule. Okay, you can place the probe atom over here, different place over the molecule. You can keep the probe atom and find out what is the electrostatic field value and what is the steric field value, that you can table it, right? So you can see that is the tabulate the each compound for what is the electrostatic field value and steric field value, and that you can correlate with the biological activity by means of partial least square analysis, and this equation you can use for the prediction. Along with this, it will give you counter map, right? You can say what are all the regions favorable for biological activity. That is the what you can where the steric bulk. Steric bulk means that is of the bulkiness of the molecule. It is in the arrangement in the space. Steric bulk is favorable, and yellow counters indicate the steric bulk is not favorable for biological activity. Similarly, blue counters where the electropositive group increase the biological activity. Red counter, that is the electronegative group, they are improve the biological activity. Okay, so this will give you what you can say that is a different say the receiver, you will get the results along with your this another 3D QSAR technique, right? So thank you for your present listening. If you have any questions, please, you are welcome.
Yes, participants, any queries? Dr. Dinesh?
So basically, this methods, what I am saying, are machine learning technique. It may be on the any field. It will depends when you are working over a period of time, right?
Yeah.
Then you can say that is having a very good experience, and you will learn the thing. And the thing is that it will, you can say that is I am working on the field of 2D QSR over a period of around from my PhD time, somewhere
Yes.
around 2003, 4, 15, 16. When you are practicing this, always these tools, how to practice, when you are practicing it, then how you can say that is your, how much articles, your research article that you are studying, how they have applied, right? So you can go through that is the literature, and also by practice, you can learn the things more, because all your this machine learning tools or your QSAR tools, that is once you practice it, then we are getting the more what you can say, we are gain more.
One question, sir.
Yes,
How
Ganesh, sir.
optimistic, sir, that we will get the best COVID medicine?
How?
How optimistic you are we are getting best COVID medicine.
COVID medicine, when we are saying, that is what we can say. So I told you what the method what I have today we have discussed. It is one of the methods. It is not like that in the what you can say in the different pharmaceutical units. Their way of doing it, right? So some companies they'll depend on the traditional method,
Yes,
and
yes.
some they will depend on this technique. But one of the beauty of this particular method, I told you the what you can say in the screen also. I told you, for example, this is the COVID virus, right? Coronavirus. You
Yeah.
can see they have given the structure of the coronavirus, right?
Yes, sir.
So when you are seeing the structure of the coronavirus, so the idea is you can go for the docking studies, right? In the docking studies, you can select the different molecules. You can design the different molecules.
Yeah.
You can say previously they have saying that is the steroid remdesivir. It was showing that is in the market they are used in COVID, right? You can
Yes.
take the remdesivir molecule and you can put it in the studies interaction with the coronavirus on a computer screen, and you will see where it is getting bind with the COVID virus, right? And you
Yes.
can see so after seeing the picture, you can see what are all the regions they are favorable for binding, unfavorable. So you can make the molecule, you can modify the molecule, make suitable substituent so that you can get a better molecule than the existing one. But again, these theoretical studies also, sometimes it may go failure also. But you can see there are a number of drugs they are available in the market. You can see that is we have seen the previously one disorder somewhere 20 years back. You can see that is even we are still also in life threatening disease. We know that is the HIV, right?
Yes, sir.
In HIV,
Mm.
in the AIDS, there is a, when you are seeing the drugs of study treatment of AIDS, there is a category called HIV protease inhibitors,
Yes.
right?
Yes.
Indinavir, retinavir, these are all the molecules. This HIV protease, it is an enzyme, right? So this
Yes.
enzyme target, they have developed this retinavir, indinavir that is based on your docking study.
Mm.
There is some success also in this technique, right? So So there are in the medicinal field there are two type of screening. One is the phenotype screening,
Yeah.
then another one is the target based screening. In the phenotype screening, what they will do? Suppose now we are having a COVID virus, right?
Yes, sir.
COVID treatment. So now I have developed some molecule, right? I am giving that molecule, right? It
Yes,
is
sir.
killing the coronavirus. You are getting cure from the COVID infection, right? But
Yes, sir.
I don't know how it is acting, what is the
Mm.
mechanism, or which target it is binding,
Yes, yes, yes.
right?
Yes, yes,
So,
yes.
but still, I can market the drug, right? There is
Mm.
this type of method that is called as your phenotype screening. Even nowadays, even if we are saying aspirin, sir.
Yeah.
Aspirin, it is we are using for a longer period of time. I think so. Everyone knows aspirin molecule. It has been discovered in 18 something, 1870 or 1880,
Mm-hmm. A
and
long
its
time.
mechanism it is discovered in 1964,
Yes.
right? So here the thing is what they have seen, the mechanism is not important. They will see if the drug is able to cure the disorder with minimum side effect, you can approve the drug. This is the one approach.
Yes.
Another approach, target-based screening. You know the receptor, how it is binding with the receptor, and you can develop. Both approaches are possible, and mostly the drugs nowadays they are focusing on target-based, but still the phenotypic drugs are coming. So in this case, if you are seeing that is your chances of your COVID drug, because every company they are after the COVID, right? Because the infection is whenever you are saving the life-threatening infection. Suppose, for example, sir, we are having a disorder. You are having a pain in your body, right? So what the drug you used to take, sir? बॉडी पेन के लिए ब्रूफन लेते हैं, ibuprofen लेते हैं, और डाइक्लोफेनेक लेते हैं, और निमोसिन लेते हैं हम, है ना? कोई भी पेन किलर लेते हैं। सपोज आपको निमोसिलाइड टैबलेट आपको 25 रुपया का कोई बंदा दे रहे हैं, और दूसरा कंपनी ब्रूफन जो है आपको 2 रुपए का देता है, तो हम लोग क्या करते हैं? विच मेडिसिन यू विल प्रिफर?
चलिए लो कॉस्ट वन,
लो कास्ट में प्रिपेयर करेंगे। तो सपोज आपको कोविड वायरस का है, मान के चलो, और कैंसर का है, ठीक है? कैंसर भी आपको बताया इट इज अ लाइफ थ्रेटनिंग डिसऑर्डर, जो जिसको कैंसर आ गया बचना बड़ा मुश्किल है। सपोज यू आर डेवलपिंग a new drug and you are saying this drug is giving a 100% cure of cancer, 100% cure of COVID, and if you are keeping the price of the tablet as 5,000 rupees, आप लेंगे नहीं लेंगे?
Obviously the choice is
है सर, वही है सर, वो कंपनी का भी यही है। हर कंपनी इस फील्ड में, मतलब आपको देखो अभी कोविड इतना हो चुके हैं, हम लोग को लॉकडाउन वगैरह लग चुके हैं, ठीक है? हर कोई आप इसमें ट्राई करते रहता है, कोई ना कोई कंपनी कोई ड्रग निकाल कर लाएगा।
यस यस,
देखो जो पहले उसमें पहले आ रहा उसको पेटेंटिंग भी होती है, मार्केटिंग राइट्स मिल जाए एक्सक्लूसिव, तो उसने कितना इन्वेस्ट कर रहा है उससे मतलब 100 गुना वो कमा भी लेगा।
We are getting so much variant of this COVID-19 that it's very difficult to tackle because the process.
मैं आपको एक चीज बताऊं, इसको हम कहते हैं म्यूटेशन कहते हैं हम लोग।
Yes, mutations.
म्यूटेशन कहते हैं। आपको देखो ना, कोई भी है, मतलब देखो माइक्रो ऑर्गेनिज्म है, इवन आपने देखो अपने जो पेनिसिलिन वगैरह है, पेनिसिलिन पहले देते थे, फिर उसके बाद पेनिसिलिन रेजिस्टेंट पेनिसिलिन भी हम नया ड्रग डिस्कवर करते हैं कि माइक्रो ऑर्गेनिज्म कोई भी है, वायरस हो और बैक्टीरिया कोई भी है, आपने एक ड्रग दे दिया, वो ड्रग उसकी माइक्रो ऑर्गेनिज्म को जाके इसको किल करती है, मतलब मार देती है, मान के चलो। तो नेचुरल प्रिंसिपल है, हम लोग उसको और कम करना चाहेंगे, हमको भी कोई मारता है, हम प्रोटेक्ट करना चाहते हैं उसको, ठीक है? तब मत अगर में तो माइक्रो ऑर्गेनिज्म भी, सपोज आपने माइक्रो ऑर्गेनिज्म एक ड्रग दे दिया, पेनिसिलिन फॉर एग्जांपल, पेनिसिलिन जो है इसकी सेलुलर सिंथेसिस को इनहिबिट करती है, ठीक है? तो इसमें क्या करेंगे, कोई प्रोटीन सिंथेसिस को इनहिबिट कर रही है कोई ड्रग, तो माइक्रो ऑर्गेनिज्म क्या करेंगे, तो कोई अल्टरनेट पाथवे ढूंढेंगे वो प्रोटीन सिंथेसिस को इनहिबिट करने का, ताकि वो ड्रग उसके ऊपर इनहिबिशन ना करे, ठीक है? तो यही है सर, डिफरेंट म्यूटेंट्स आ रहे हैं ना टाइम के हिसाब से, मतलब हम कर रहे हैं, कोविड-1 का कर दिया, कोविड-2 हो गया, अभी जो नया भी आया है, मतलब ये सारा मतलब म्यूटेशन की वजह से है। बट ये है ओवर द पीरियड ऑफ टाइम है। सपोज आपने देखो फ्लू आया था सर एक टाइम में, है ना? फ्लू मतलब कितना खतरनाक था कोल्ड का, इसलिए जब आए थे। अभी धीरे धीरे क्या हो गया देख लो आप, धीरे धीरे हम लोग फ्लू आए, कुछ दवाई ले ली, हम चल पड़े। ऐसे ही कोविड का भी ऐसे हो जाएगा कुछ टाइम के बाद। तो आपको जैसे जैसे म्यूटेशंस होते हैं ना, तो अपने बॉडी की इम्यूनिटी पावर रेजिस्टेंस भी तो आ जाती है, बॉडी भी सबको डिफेंस से में फाइट करेंगे। बाकी दवाई कोई टैबलेट आप तो ले आएंगे सर, जरूर आएंगे।
You are very optimistic to get the right drug for the COVID-19.
ये तो पॉसिबिलिटी है सर, मैं आपको बताता हूँ, कोई भी है ना।
Yes.
तो आएंगे।
So, any queries from the participants? Dr. Praveen? Dr. Praveen, are you there? Anyhow, thanks a lot, Professor Narasimhan. It's very enlightening, especially in COVID in a scenario where we need definitely a good combination of drugs, so that we can fight back and get back to normal condition. that we are facing for the last 2 years. So hopefully, the pharmaceutical industry will get new drugs and new combination, and of course the new vaccines, so that we can get back to our normal routine.
Okay, sir.
Okay, thank you, sir. Thanks a lot. It's really nice.
ओके सर, थैंक यू। उम्मीद के साथ ही है सर, जिंदगी चलती है, देखो मिल जाएंगे दवाई।
Of course, of course.
जो पॉजिटिव रहना चाहिए।
Yes, be optimistic.
ठीक है।
Thank you, sir. Thank you. Just winding up now, right now. We are winding up the session, and we'll meet tomorrow for a new session. Thank you. Thank you.
Okay.